Good evening and welcome to 5 on 5. I'm Sherry Small and I'm joined tonight by Dr. Bruce Goldberg. He's the head of the Oregon Health Authority. Dr. Goldberg, thanks so much for being with us tonight.
Pleasure to be here.
And what's topical, what's on a lot of people's mind right now is the Affordable Care Act and how they can get signed up for health insurance under the Cover Oregon website. We know there are some glitches with it. Where does it stand now?
I think as you said, the Cover Oregon website right now cannot enroll people. What people can do is they can go on the website, they can shop for health plans, they can browse, they can choose a plan based on quality, but they can't sign up for a plan. So what we're asking people to do is to send in a paper application.
Okay.
We've been processing paper applications in the state for the last couple of decades, and unfortunately it's just going to need to be another month or two more that people will need to do paper applications. But if people get their applications in by the end of the month, we can get them processed and they can get coverage that will start January 1.
What is a typical processing time for the paper application?
It takes about, for a complete application, it takes a worker about an hour to process an application. And then people will get something back that says they're eligible. It'll tell them what their tax credit is, and it'll give them an opportunity to choose a health plan. And they'll be able to do that either by a phone call or sending something back in.
Okay, so is it reasonable that if people jump on this right away and they get their applications in, that they might have health coverage by the first of the year if they need it?
Yes, we're staffing up at the state right now. Right. Between Cover Oregon and the Oregon Health Authority, we're hiring people, we're training them, we've got them space. We have several hundred people that we're going to be bringing on to do this work over the next month. It's that important. And we're confident that if people can get their applications in by the end of the month, they'll be able to get coverage on January 1.
Okay. And how many people have sent in paper applications so far?
It's been about 5,000 to 6,000 people that have sent in paper applications, and we're beginning to process those. One of the big issues is that sometimes people send in applications that aren't complete. So if people take some time and are careful and get that in there, that's going to be really helpful.
All right. Thank you so much. Stay with us. We have more questions for you right after the break, and you stay with us as well. We'll be right back. Hello and welcome back. We are joined tonight with Dr. Bruce Goldberg, who is the head of the Oregon Health Authority. He's been telling us all about how people can get signed up through Cover Oregon, not the website, but through paper applications right now. What about people who are eligible for or who are on Medicare? Do they have to do anything? A lot of people are confused about this.
No, people that are on Medicare have their Medicare coverage, and the Affordable Care Act doesn't impact them, which is a great thing. They've got health care, and that's a good thing.
And what about Medicaid?
Now, Medicaid is different because we have an opportunity in this state for several 100,000 people to get Medicaid coverage. What the Affordable Care Act does is it isn't just about choosing a commercial health plan. We have expanded our Medicaid program for individuals who have incomes up to $15,000 or families of 4 with incomes up to $32,000. They will now be eligible for the Oregon Health Plan. No lotteries, no waiting lists. The issue is people need to sign up. And we've got approval from the federal government for individuals who are on SNAP, that's Oregon's food stamp program. If they've already have an income that qualifies them, they've gotten a letter in the mail. 240,000 letters went out several weeks ago. And all those individuals need to do is say that they would like to be on the Oregon Health Plan, sign a form, and send it back in. It literally is that easy. We're calling it fast track. We've had 74,000 people as of yesterday get their forms back. That means that alone is going to decrease our uninsurance rate by 10%. So if viewers, if you have gotten that fast track letter, if you're on the SNAP program, send back that form. You can get really important health care.
They're already qualified.
They've pre-qualified. They've had their income qualified by the Fed, so there's no need to go through the website to fill out an application. They, in essence, have already qualified for one federal program, and this qualifies them for another.
And Medicaid has expanded, as you said, so if people are curious that maybe they didn't qualify before, they may indeed qualify now?
Yes, and they can get information. They can go to www.coveroregon.gov and they can put their income in. They can see what they're qualified for. Individuals can also go to our website, health.oregon.gov. There's helpful information on all of this. I think the big thing is find out what you're eligible for. If you've gotten the fast track letter, get that in. If not, and you don't have health insurance coverage, this is a great opportunity to fill out an application and get coverage.
And fill it out, send it in on paper.
Send it in on paper.
All right.
We've got a great healthcare system in this state. We want everybody to have access to it.
All right, Dr. Bruce Goldberg, thanks so much for joining us. We appreciate your time. And thank you. We'll be back in just a moment.